Welcome to the Azul Optics Quick Start series. This training course will cover how protective products can help people who score low on the MPI. When a patient scores low on the MPI, it's not necessarily a sign of anything being wrong now, but it is an indication that they're at greater risk of retinal damage later in life. The first thing to tell them is that it's really great that you were able to find this out today, because there are plenty of things that they can do now to protect their eyes for the future. A score of 4 or less on the MPI puts a patient in the lower end of the population distribution of MPI scores, and it indicates that they have a low total volume of macular pigment. These patients are more susceptible to retinal damage from high-energy visible blue light and from free radicals and reactive oxygen species. Over time, they may be at greater risk of accumulation of lipofuscin and drusen, and developing age-related macular degeneration. Low scorers on the MPI test should consider taking extra precautions to protect their eyes from blue light, just like someone with fair skin would take extra precautions to protect their skin from ultraviolet light by covering up and using sunscreen. But unlike fair skin, a person with low macular pigments can also take actions to improve their natural protection by increasing their macular pigment levels and modifying behaviors that reduce macular pigments. To improve their natural protection, low scorers can increase their intake of dark green and brightly colored fruits and vegetables, use eye supplements containing at least lutein and zeaxanthin, quit smoking, lose weight, and increase fitness. To reduce blue light, low scorers can make simple changes to decrease the amount of blue light they're exposed to. For example, avoiding direct sunlight, wearing a hat, and using protective eyewear that will reduce the amount of blue light reaching the retina. So let's look more closely at how some of the products you can recommend can help reduce the blue light hazard for your patients, especially those who score low on the MPI. Blue light is the short end of the visible light spectrum, right beside ultraviolet. And, like ultraviolet, blue light has enough energy to cause the formation of free radicals and reactive oxygen species. The International Organization for Standardization, the ISO, have used decades of research to identify the wavelengths that are most dangerous to the retina. This is called the blue light hazard function. People who have high macular pigments have a lower relative blue light hazard because their macular pigments provide greater natural protection against blue light. But those with low macular pigments have much less natural protection against the blue light hazard. Many products you sell can help people who score low on the MPI to reduce their exposure to blue light and therefore reduce their long-term risk of retinal damage. When indoors, or for patients who use computers regularly, blue light filtering coatings and lenses can help further reduce the blue light hazard. For outdoors, a good pair of sunglasses can greatly reduce the blue light hazard. Another great option are photochromic lenses, which can be both blue light filtering when not activated, and when activated can offer the same level of protection as sunglasses. Research has shown that providing people with a measure, like their MPI score, increases their likelihood of making good lifestyle choices. For this reason, the conversation that you have with your patients about their MPI score is a great opportunity to inform them about the importance of macular pigments and empower them to make lifestyle choices and use products that can help protect their vision through life. So that's the end of the course. We hope this has helped you to understand how different products can help protect patients who score low on the MPI. For more information, please visit our website at www.azuloptics.com.